Namaskar. I am Dr. Sanjay Saxena. I am the Senior Director and Head of Neurology at Max Hospital, Vaishali. Today we will be talking about migraine, how common is that, how it's diagnosed, and how to manage, cope up with migraine attack. So headache is one of the commonest symptoms for which a patient visits a hospital or a clinic. And out of all these headaches, migraine is the commonest type of headache. Migraine means one half. It's a Greek word and it means one half. So one of the classical feature of migraine is pain affecting one half of the head. So it is a unilateral headache, and we can actually remember a short acronym, POUND, for that. P means the character of the pain is pulsatile. It's a pulsatile headache and it occurs for at least 4 hours and lasts up to 72 hours, one individual attack, which affects one half or unilateral. It is a kind of headache which is associated with various other features like nausea, vomiting, and whenever a person tries to move or try to cough or sneeze, the headache gets worse and it makes the person disabled. Probably a myth that migraine can lead to brain tumor, but it can lead to an equally bad complication if the proper treatment is not taken at the right time. It can lead to brain infarctions or hemorrhage in the brain. It can lead to epilepsy or seizures. It can lead to psychiatric disorders like depression and anxiety. It can lead to cardiac infarction or heart attacks. It can lead to being associated with some kind of respiratory disease like bronchial asthma. So I think there's whole lots of diseases which can be attributed to migraine, but brain tumor is not directly connected to migraine unless a brain tumor presents with a headache which resembles a migraine. So it would be a mimic of migraine, not a complication of migraine. So now as the migraine is evolving, we still do not understand the exact hypothesis or the reason for migraine, but now with better understanding of the diagnostics and the technological advancement in the science, we have evolved and we have found out few more reasons why migraine occurs. So one of the important target therapies which has been recently developed and approved is the calcitonin gene-related peptide, so CGRP. So this is a kind of pain-producing substance against which we have developed few medicines, and 2 years back, monoclonal antibodies like adalimumab, etc., they have been approved. This is a therapy to prevent episodic migraine or treat a chronic migraine. So these are injectables which are given mostly subcutaneous once in a month, and no other medicine is required, only SOS painkiller if required. So they can be given safely for up to 6 months or 1 year, depending on the clinical condition and the severity of the migraine and the decision taken by the clinician at that point of time. So this is a very effective latest therapy. Apart from this, we don't have the other oral tablets in India, but in US and some of the countries, there are few oral tablets which have been approved, and these are the tablets which, if abort an attack of migraine very effectively without any side effect or rebound phenomena, which was found with other treatment modalities of triptans. And there are some more drugs which have been developed to treat episodes of migraine or prophylactic therapy also. So we have lot many things in store, not only medical treatment, there are certain non-medical treatment like neural stimulation which have been used, and it is called remote neurostimulation, which can be used to control even an acute attack of migraine. So various neuromodulation, some block of the nerves which can be given an injection and block the nerve, the effect can last for 3 months or 6 months. Various other methods have been evolved and approved. Now we have a full basket of treatment for migraine, starting from aborting an attack with effective oral therapy or subcutaneous or injectable as per the requirement. We have treatment to prevent occurrence of these headache, which is the most effective way of treating migraine. Some oral tablets, some newly evolved injections including botulinum toxin and monoclonal antibodies, and we have non-pharmacological treatment also, which is a neurostimulation from the remote site. It can getting a repeated giving stimulation in the arm can in fact anesthetize the pain circuit as well. So we have full basket now. So don't ignore your migraine, as we are aware that I've been discussing about that. It's one of the commonest types of headaches, and it's been found that up to 20 to 30% of the females in a given population in the age group of say 20 to 50, they suffer from these headaches. So it's that common, and it's a disabling headache. It can lead to lots of problem with daily life, with the professional life, with the family life, personal life, and later on it can lead to even some major complications. Some people, as I discussed with you, can get seizures, epileptic attacks, heart attack, brain attack, respiratory diseases and psychiatric diseases. So we should be aware migraine is something which, if cannot be cured forever, it should be controlled and treated in order to remain better in today's world and prevent any future complications which it might lead to. So remain alert. Find that your headache is not just something which can be treated with the painkiller. Go to a doctor, seek an opinion. If a long-term treatment is required, please go ahead and keep a regular follow-up with your treating doctor. Thank you very much for your patient hearing.